Health Matters, presented by Parker Life. We make aging part of life.
In today's Health Matters, nearly 500,000 New Yorkers live with Alzheimer's. The disease is a growing public health crisis across the state.
And while the problem is here, the solutions may be as well. And that's because one local doctor was just awarded a $500,000 grant to identify ways to slow down the progression of Alzheimer's and get one step closer to a potential cure. So joining us this morning is Columbia University neurology professor and one of the winners of the Cure One, Cure Many award, Dr. Caghan Kizil. So Dr. Kizil, great to have you here. Congratulations, by the way, on that $500,000 grant. That is huge. Talk to us about Alzheimer's disease for a moment, because two people can have, I guess, similar risk factors with different outcomes. Kind of explain that for us.
Well, that's true. That's because Alzheimer's disease starts much earlier than it is diagnosed. And we are studying what happens in the brain years or even decades before the memory problems start. And we think one of the first things happening is initiation of a neuroinflammation in these tiny blood vessels around in the brain. And we think that if we can stop it early, so we may have a possibility to delay the disease, or maybe at one day even prevent it.
Yeah, so can you talk about that a little bit? Because Alzheimer's is caused by a buildup of a certain protein, right, and inflammation in the brain. But you discovered a molecule that can kind of help break it down, or can you explain that? Yeah,
that's right. So we discovered one of the earliest things happening in the brain, and we think it's happening around your blood vessels. And the brain, all brains have a security gate. So if you will, it's like a door that is around your blood vessels and allows nutrients and oxygen to go from the blood to the brain. And if the brain generates waste, it's clear. But what happens in Alzheimer's disease is that this door is transforming into a firm brick wall that is impermeable to anything. So that initiates neuroinflammation and it amplifies it. And interestingly, we found that this wall formation, one of the components there is a protein called fibronectin. And very interestingly, again, we found in some people a genetic change in this fibronectin gene. And these people prevent the buildup of this fibronectin and buildup of this wall. And these people have 71% reduced Alzheimer's disease risk. A majority of them never get it. So if we can reduce the buildup of this protein with a medicine, maybe we can design potential treatments in the future, prevent it.
A cure obviously is something everybody wants, right? When it's what you're working towards. Who is somebody, I guess, who is most susceptible? Is it somebody who gets less sleep? You know, is there like a typical patient you see, or it doesn't discriminate?
Oh, the lifestyle factors. So since this is taking decades until before a neurologist you sit and you get the diagnosis, there are many different ways you can go there. Sleeping is one, as you mentioned, an important factor because it helps this gate to open at night and then clear the brain. So if you get less sleep, you definitely get less clearance. So it seems like many things are connected. And actually, we are very grateful to American Brain Foundation and this Cure One, Cure Many award, because if we can understand neuroinflammation and we can cure it in Alzheimer's disease in a certain way, so this could be applicable and generalized to larger other diseases, so it will have a better impact.
Is it partly hereditary, though?
Oh, Alzheimer's is hereditary as well. So there are two types of Alzheimer's. So you can inherit it, and it's causal. That's like 5% of all patients. But the rest, 95%, have risk factors. So risk factors doesn't mean that you will get it. But if you don't manage those risks properly with lifestyle and with other aspects, then you may get it. So we are trying to mitigate this risk for 95% so that
so what's next? So what's next in the research? Because when everybody hears about a new potential cure or a drug, that there's clinical trials and so on and so forth. So what's next for you?
And what's next is going to humans, the clinical trials. So we have done experiments. We are very excited about that. And we would like to start the clinical trials and see whether it works in humans as well, so that we can maybe just delay the onset. And the dream is, of course, just giving back these people their memories
Yeah.
and
Yes.
a healthier life.
Oh, wow.
And there's hope.
Amazing. Amazing research. Thank you so much and good luck with it.
Well, thank you for having me.
Huge. Congratulations. That's
Thank you.
amazing.